Good morning. Welcome and thank you for joining us today in our webinar entitled the 87th Legislative Session, Interim Opportunities, Updates in the Fight Against Obesity. For those of you that do not know me, my name is David Lakey. I currently serve as the Vice Chancellor for Health Affairs and Chief Medical Officer of the University of Texas System. And I'm here today serving as the Chair of the Partnership for a Healthy Texas and will be moderating today's webinar. Before we start, I need to make a few housekeeping announcements. First, this webinar is being recorded and will be archived along with the presentation slides at our website at msdcenter.org. And second, if you have questions, please enter them in the chat box. We'll have time to answer the questions at the end of the presentation. I want to start by thanking the Michael and Susan Dell Center for Healthy Living, who is hosting this webinar, and for all the work they are doing to build the science behind obesity and the obesity epidemic in Texas. We're going to hear today from Dr. Deanna Hoesler about their important work looking at SPAN data and finding ways to share that data in an impactful way with policymakers through the Research to Policy project. We will also hear from Joel Romo, the chair of the Legislative Committee for the Partnership for a Healthy Texas, about work the partnership and its members organizations undertook during the 87th legislative session to advance policies that address and prevent obesity in our state. He'll share some of the context around the legislative session, the outcomes, and what work needs to be done before the 88th legislative session to educate lawmakers about this really important issue. Before turning it over to Joel, I want to say a few words about the importance of these issues. Even prior to COVID-19, this pandemic, there were many issues competing for the attention of lawmakers. The health challenges our state faced pre-pandemic are still present and have only been made worse because of the pandemic. We still have significant health disparities, and too many Texans suffer from and are dying from the complications of chronic diseases. Many of these diseases are the result of obesity, and unfortunately, many of the challenges of obesity start in childhood. You will hear today about the prevalence of obesity in Texas and how high it was before the COVID-19 pandemic, and that the pandemic created an opportunity for increases due to the changes in physical activity and increased food insecurity. At the same time, the crisis highlighted both the importance of a strong public health infrastructure and the heightened vulnerability of those living with obesity. As children return to schools and families to work, we have an opportunity to address the crisis in our state. The cost of obesity in Texas is staggering, not only in the cost to individuals' health and future, but also to Texas businesses. In 2011, State Comptroller Susan Combs, in her report entitled Gaining Cost, Losing Time, estimated that the obesity cost Texas businesses $9.5 billion in 2009, and estimated the annual cost in 2030 to exceed $32 billion. Furthermore, in 2018, a report by Mission Readiness noted that obesity disqualifies 31% of Americans' youth between the ages of 17 and 24 from serving in the military. The work of the partnership and the Michael and Susan Dell Center for Policy Collaboration project are critical to bringing data to our policymakers in an easy to comprehend way and helping them understand the urgency of this issue. Texas can lead the nation in passing policies to support healthy Texans and ensure the viability of Texas's future's workforce. Now I'll turn over the virtual podium to Joel Romo, the chair of the partnership's legislative committee, to talk about the 87th legislative session and interim work. Joel has worked for members of the Texas legislature, having served as the chief of staff and advising policymakers and legislators on their agendas and the state budget and key policy issues impacting their districts in the state of Texas. Currently, he's the Vice President for Government Affairs at the Cooper Institute and President of the Texana Public Affairs, and is the Legislative Committee Chair for the Partnership for a Healthy Texas. His lobbying experience includes past positions as a Government Relations Director for the Association of Texas Professional Educators and as Assistant Director of Government Relations and Communications at the Texas Municipal Retirement System. Joel, I'll turn the podium over to you. Thank you.
Thank you, Dr. Lakey, and thank you everybody that's on our call today. It's an honor to be here with everyone today and share with you the opportunities that exist, give a little recap about the past legislative session, and of course, updates on other priorities that the Partnership for Healthy Texas is working on. As Dr. Lakey mentioned, our mission of Partnership for Healthy Texas is to develop and promote state policies that prevent and reduce obesity. We look at what works for Texans. We set those priorities for our legislative efforts, and we follow through and work through committees of the coalition to make sure they're successful. Partnership for Healthy Texas has been around since 2006, when key health-related organizations work together to address and come together and identify priorities that would impact and address the issues of obesity in Texas communities. The partnership brought together in addition to policy, but we brought experts on statewide policy, research, the Texas Obesity Policy Portfolio, which have identified evidence-based policy initiatives that have proven to have a positive impact on fighting obesity. During our first session in 2007, lawmakers passed 5 of our 6 legislative priorities, which we attributed to a great success and work of the coalition. Now we are the most recognized and valued advocacy voice to fight in obesity in Texas at the Texas Legislature. In the historical accomplishments, we passed legislation to require minimum minutes of physical activity in schools and established FITNESSgram in 2007. We've fought back efforts to eliminate coordinated school health and the FITNESSgram or physical fitness assessment requirements. We work closely with the Department of Agriculture to put nutrition policy and rule through the regulatory process by providing public comment and attending those agency hearings. We work to not only preserve, but also try to strengthen our school health advisory councils, and you'll be hearing more about that, by expanding the scope to all components of coordinated school health and accountability. And then we've also supported the passage of state funding for evidence-based obesity prevention initiatives at the Department of State Health Services. And this is all with input from all our members and stakeholders, and of course using research and data to make our case. As you see, our organization is it's made up of members from across the country that are national as well as state organizations. Our partners have helped us carry the mission at the state capitol and state agencies, and bring their expertise in terms of research, science, advocates and grassroots and legislative efforts together to make the partnership a successful organization. Recently, we just released our State of Obesity report in this past December, and you can find that online, and identify the impact, not only financially as what Dr. Lakey laid out at the beginning, but we've also identified the priorities and opportunities that may exist for us in terms of moving forward and identifying our priorities. And you can find that online by visiting the partnershipforhealthytexas.org. Now, here's how we develop our policy priorities. The coalition, the full coalition and our membership, we do surveys to discuss the issues of obesity and healthy living. We get data from our research partners to process it and really kind of conceptualize those recommended policy solutions. Our steering committee then weighs the political feasibility of what those proposals, where they may have an opportunity, whether it be at the legislature or through a regulatory process. We could spend quite a significant amount of time going through this, to ensure that every organization's input is heard, to ensure that we are properly gauging everybody's interest, but as well as utilizing that information and data that's available to us. So on that note, let me give you a quick update on how we performed this during the recently adjourned legislative session. We started the amend during the COVID-19 pandemic. So as everybody is well aware, the access to the Capitol was limited, and we also were sitting in an unheard of what's going to happen to the state budget. We were already hearing that there's going to be shortfalls, and there was so much uncertainty. There's really a big question mark, you could say, about how the legislative session was going to operate. 1 month into the session, of course, as everybody remembers, then Winter Storm Uri hit, stalling committee proceedings and those committee budget process, everything. In addition to that, we had new leadership in terms of appropriations, public health, public education. And so it was almost like the best case scenario, perfect storm, no pun intended, for challenges to the coalition and all organizations that were walking the halls. It was a different session in terms of, the halls were a little bit less crowded. Meetings were more virtual, and you had to schedule a lot of your meetings ahead of time. But the coalition did meet regularly. We met weekly as a legislative committee, not only to scrub bills, but ensure our priorities were being advanced and processed. There were 1,074 of the 6,900 bills filed, or you could say 15% finally passed. And in prior session, in 2019, 19% of those bills passed. The priorities for Partnership for Healthy Texas, the 87th legislature included recess policy for schools, increasing quality PE and health education requirements, fully funding the surplus agricultural products grant program, encouraging initiatives to address the social determinants of health, improving SNAP access for our seniors, promoting the whole child school health policy approach, protecting health education, protecting chronic disease funding at the Department of State Health Services. And again, those priorities were developed through the process that I mentioned before with everybody's input. And here's how things played out. The recess policy for schools required schools, districts to create or institute recess policies that reflect the best practices and consider those recommendations that came from our school health advisory councils. It would increase middle school and physical education. We also had a proposal that would increase physical education requirements at the middle school level for 6 semesters and high school PE requirements for 3 semesters, where that previously was many years ago, and reinstating the 1 semester of health education in high school. House Bill 1594 by Representative Alma Allen, unfortunately, was filed, as was House Bill 2887 by Representative Tallarico and 3058 by Representative Gedab were filed. Neither proposals were given a hearing. It was very, as many folks may, and our partners that are listening today, the hearings were very tightly scripted in terms of issues. At the beginning of the session, a lot of committees, were trying to limit the amount of time spent in committee rooms, and committees were limited on access to different committee rooms because of the pandemic. But we weren't able to see any success in those, but we also didn't see any efforts to repeal what's currently in statute for PE, as well as fitness assessments. In terms of the surplus agricultural products grant, our goal was to fully fund this effort to ensure food banks have produce to keep Texans from going hungry. Our outcome, and thanks to the partners in the coalition and many of those that spent countless hours working the appropriations and the Senate Finance, prior to the session, the Department of Agriculture proposed a $1.9 million cut to the program. And House Bill 2, the $1.98 million cut was fully restored for the fiscal years 2021. And then SB 1 fully funded this grant program at the rate of $10.2 million for the fiscal years 22 and 23. And again, we use data and evidence-based testimony to work the committees and ensure this effort was restored. Social determinants health, there's a lot of discussions on these issues. We're trying to encourage Medicaid managed care organizations to implement initiatives to address these social determinants of health. Various proposals were filed in the Senate by Senator Johnson, which never received a hearing in Senate Health and Human Services. We were able to attach propose a rider in SB 1, which was moved to Article 11 and unfortunately just not adopted. There were a couple of other proposals that were House bills by Oliver and Coleman that created pilot initiatives, were created in the Office of Health Equity within the Health and Human Service Committee. Some of these proposals passed, but were left pending and never saw any advancement or consideration in the Senate. But the discussions were held, and we will continue working on these efforts. In terms of SNAP, this is one of our highlights. We were able to, our goal was to increase access to SNAP benefits for our seniors by streamlining the application process and implementing data matching with Medicaid. Senate Bill 224 by Senator Perry and Representative Wally simplified the certification and recertification process for seniors and implemented data matching with Medicaid. Passed the Senate and then came over to the House and Human Services Committee House Human Services Committee and the House, and then passed the House by a vote of 117 to 28. And this one was signed by Governor Abbott on June 16th and just went into effect September 1st of this year. So kudos to all the organizations that helped advance that effort, whether it was testimony, direct lobbying, and of course, getting support in committee. Whole child school health policy will promote and protect the efficacy of Texas whole child school health policy approach through the school advisory councils and physical fitness assessments, also known as FISBNPA, to provide us the tools for tracking children's health and fitness. The funding for physical fitness assessment was maintained in SB1 at a rate appropriations of $1.9 million. And then SB 340, there were numerous bills dealing with school health advisory councils this session that seems like school health advisory councils were subject to legislative interests for various social issues, none of them really pertaining to the actual the goal of our health advisory councils was to provide guidance to the school boards and our parents, but they came under the radar. Some social issues. There were bills that were subject the SHACs to government open records laws as government bodies. The Senate Bill 442 sought to increase SHAC transparency. The partnership worked with these offices. We engaged our partners to remove these provisions. We were successful. We weren't successful. At the end of the day, unfortunately, House Bill 1525, which was one of the major education pieces that was negotiated in the final hours of the legislative session, this school SHAC transparency legislation, which requires open meetings and recording of the meetings, was added to House Bill 1525. In terms of health education, there were no attempts to roll back any existing physical or health educations, as mentioned earlier, which our coalition was prepared to defend these efforts given the pandemic and the uncertainty of school curriculum and where schools were virtual for this past year because of the pandemic. We did get the bills filed to try to strengthen those proposals, but we'll take the win. And since that there were no efforts to try to repeal these efforts, I think there was gives us an opportunity to, and we'll get to that at the end when we go over some of our interim studies, but the discussions were held on the importance of PE and health, and we continue to have those with lawmakers. Health funding, there was vital public health funding at the Department of State Health Services, including health promotion and chronic disease prevention. These programs were fully funded at $14 million for each fiscal year, and Senate Bill 1 that was passed. And so the successes were Senate Bill 224, as I mentioned, the funding for the surplus ag grants protected. We were able to preserve existing physical fitness assessments and fitness gram and chronic disease funding. We protected the integrity of school health advisory councils, and we have additional work to do there that we'll get into. And then we identified opportunities to continue working with lawmakers on key chronic disease issues and elevated the issue of obesity during this pandemic as we are prepared for future successes with the partnership. And looking ahead, where we are, well, as many of you may know, the House leadership has asked that interim charges be submitted to the committee chairs, and the committee chairs submit those to the speaker by Monday, November 22nd. Thankfully, the partnership has already crafted our interim study proposals to help to guide the work of the 88th legislative session. We are working with lawmakers now to share some of those, and we'll get into that in a minute. But we're going to use the interim as an opportunity to continue to educate policymakers and our partners about the importance of addressing obesity during this time as we prepare for the 2023 session, as well as cultivating legislative champions. As everybody's aware, there will be a significant turnover in both the House and Senate, and this will give us an opportunity to identify new champions in terms of supporting our initiatives and addressing this issue. So right now, here's where we are, and we can make sure that these proposals are shared with everybody, whether it be our website or follow up after this webinar. But one of our proposals that directly falls under the House Human Services Committee and Senate Health and Human Services is to identify opportunities for Medicaid managed care organizations or healthcare providers and communities to partner to implement these non-medical initiatives that address social determinants of health that will help the patients be healthier and more productive at home, work, school, and also containing Medicaid costs. And that's where our coalition will spend time on educating lawmakers about the impact of these different opportunities to address Medicaid managed care that will help reduce some of these issues as well as improve productivity. We are working to share those with leadership in those committees as well as the lieutenant governor and the speaker's offices, and hoping that we are able to have these discussions in 2022. Additionally, we are looking at, as I mentioned earlier, the impact of COVID-19 pandemic had on physical activity. We are certain there's many data and reports that demonstrate that there was a decline in physical activity across the country, not only in Texas because of the pandemic, as well as increased dietary intake. And our goal is to examine how school meals, physical education classes, and other areas of the school day were impacted by the pandemic, and how we can utilize this to strengthen PE, health education, and other areas of opportunities to address, to demonstrate to the students and the parents the need to remain physically active, physically fit, how that correlates into better academic performance and workforce productivity in the long run. So we will be sharing this request with the House Public Education Committee and Senate Education Committee as well. Look forward to working there. And then also House Insurance and Senate Health and Human Services. We are looking at identifying and studying the availability to address obesity treatment, management, and care options not yet covered by Medicaid or the state employee health insurance cost, with the state that will create a cost-neutral, cost-positive framework for the state. And then we've already been working on interim hearings and providing testimony and addressing these issues. On October 4th, our coalition provided testimony to the House Public Health Committee during their interim hearing on access to health care in communities near the Texas-Mexico border. Our testimony highlighted the burden of obesity near the border and potential solutions to help address and prevent obesity in this area, in this region. We've also shared and acknowledged our champions during this interim, Senator Charles Perry and Representative Armando Wally, were our 2021 Partnership for Healthy Texas Legislative Champions for their work on Senate Bill 224. And then we will begin forming legislative policies, as I mentioned, with not only with those interim proposals, but we will continue identifying opportunities and policies that may provide us the discussion opportunity with lawmakers, regulatory leaders to address obesity. We are only we're back a year away, a year and a couple months from the 88th regular session, which convenes January 10th, 2023. Legislative pre-filing, which many of you may be familiar with, it always occurs the first Monday after the general election prior to a session. We're exactly a year away, that kind of scary, that we'll all be reading bills by now in terms of proposals for the 88th session. And as I mentioned earlier, the interim hearings will most likely begin in January or February in the House and Senate as lawmakers study those recommendations that will be submitted and formalized by the leadership offices, and the Partnership for Health in Texas will be there to provide our guidance and input. And we look to have more folks get involved with the partnership by signing up for our coalition emails through our website. You can apply on behalf of your organization to join the coalition and the steering committee. As you can tell, we are in full process of crafting our policies for 2023. And we will be working on those and sharing them at our full membership meeting this coming June. Again, I want to thank the Michael and Susan Dell Center for Healthy Living for having the Partnership for Healthy Texas be part of this discussion today. Appreciate Dr. David Lakey's guidance during the session and input, as well as his moderating this panel today. And we look forward to working with you as we prepare for the 88th legislative session.
Very good, Joel. Again, I really do appreciate your leadership and the work that you did during the legislative session and the special sessions related to these issues and the other important issues that you've helped shepherd through related to health each and every session. It is now my privilege to introduce Dr. Deanna Hoesler. She is the Regional Dean for the UT School of Public Health in Austin, the John P. McGovern Professor in Health Promotion and Behavioral Science, and the Founding Director of the Michael and Susan Dell Center for Healthy Living. A registered dietitian nutritionist, she's licensed in Texas and is a certified nutrition specialist. Her research interests focus on teaching children and their families how to engage in healthier behavior to prevent chronic diseases, with an emphasis on eliminating health disparities. Her work includes research in child and adolescent nutrition, school and community-based health promotion programs, dietary assessment methodology, evaluation of child obesity policies, linkages between primary care and public health, and dissemination of school health programs. She is currently the principal investigator of the Texas School Physical Activity and Nutrition Texas SPAN, a survey funded by the Texas Department of State Health Services. This study established a surveillance system to monitor the prevalence of overweight, obesity in school-aged children in Texas, and has been conducted since 2000. Deanna, it's great to have you here, and I'll turn the virtual podium over to you. Thank you.
Thank you, Dr. Lakey, and thank you, Joel, for that very informative presentation. It's great to have partners like the Partnership for a Healthy Texas to work with on these important legislative issues. So today I'd like to talk about some of our efforts to translate research to policy, and I'll show you some of the tools and techniques that we've been using this past legislative session. So the Texas Research to Policy Collaboration, next slide, please. Has three, I'll start out with talking about this, and then I'll talk about some of the tools that we use. So the Texas Research to Policy Collaboration, or Texas RPC, has three main goals. So the first is to improve the health of Texans through policy making. So to assist legislators and provide better use of Texas research data and resources. So how can we get local information to the legislators? Secondly, to engage state and local stakeholders in capacity building. So we really want to provide a nonpartisan network of health researchers that legislators can call on. And then third, to respond to state legislative requests. So we do this by facilitating researcher policymaker connections and then support requests for information that eventually informs policy. So next slide, please. So our timeline here, as you can see, we started in December of 2019, so 2 years ago. And at that point, we began recruitment of both researchers and legislators. We conducted a policy need identification needs assessment and then set up training for the researchers. The policy identification needs assessment, what that did was kind of looked at what health issues the legislators were interested in. Then beginning in May 2020 through September 2020, we began having legislator researcher collaborative meetings in which we facilitated communication between the two. And we also launched a COVID-19 newsletter. From August 2020 to the end of the 2021 session, we continued to provide the newsletter as well as continuing our meetings, and then continued our training efforts for researchers, recruited new legislators, and then conducted an end-of-session briefing. So now we're to the point where we're following up with our survey instruments just to see kind of what we learned during the past year. Next slide, please. So a little bit about the legislators. When we did our policy needs assessment, we were able to recruit 21 legislators. They were from both the House and the Senate. As might be expected, most of them were up for re-election at the time we recruited them, and all but one won re-election. And then most of our baseline interviews were conducted with the legislative staff. Next slide, please. So a couple of the findings from our survey is we found that there's a relatively high use of research among the legislators, especially for development of policy. They perceive research to be important in their work. However, they had few interactions with researchers, and especially when it came to developing research direction or priorities. So that's where we were able to step in. They often obtain policy-related information from people that were involved with a particular policy or program, and then nonprofit organizations or foundations. And fewer offices reported obtaining information from researchers or conferences. So that's the place where we would get most of our information. Next slide. So now I'd like to talk about the researchers that we engaged in the policy. And what I want to show here is just a distribution of the researchers that we had as part of our RPC project. So as you can see, most of them were in Central and South Texas. We also had representation in West Texas and then North Texas. So these roughly follow where a lot of the universities are located within Texas. Next slide, please. So as part of this, we needed to train the researchers to work in the policy world. And so one of the things we found is that our training was very valued by the researchers. And so if you look at how we did the training, we did have an in-person training, but the majority of researchers had a web-based training. So that was easier for them to fit in. And this is all taking place during COVID. So again, it was easier to facilitate that way. We also asked the researchers, how often have you interacted with policymakers and their staff? And there was a small percentage, almost 14%, that said all of the time, but more of them reported never, occasionally, or rarely, as you can see in the pie graph here. Next slide. So from June 2020 to September 2021, we developed and then we disseminated health policy resources to state legislators and their staff. And so we developed these in working with network researchers. And this is where our Texas SPAN project comes in, because we use those Texas data to develop a lot of these resources. So we did a series of health policy reports, and I'll show you some of those. And these were in response to what the legislators told us they were interested in. So we really wanted to make sure that they were relevant. And then we developed other resources that we posted on our webpage and then distributed through our newsletter and via email. So next slide. So in terms of our health policy resources, we developed 28 health policy resources that we then disseminated. So we developed a few. You can see a snapshot of them here. As you can see, the majority of them were around COVID-19. So they were things like protecting our children from COVID-19, myth versus fact, considerations for reopening K through 2 schools. So these were focused a lot on our child expertise. We had a few health policy resources around SNAP, several at state and legislative district level data. So we were able to identify that and use GIS maps to use that. And then we used a lot of the data from SPAN to develop 10 Texas Child Health Status reports. So these were on a variety of topics. So if we could go to the next slide, these show kind of examples of the resources that we developed. So most of these incorporated as much Texas data as we had. They tended to include a lot of graphics, and then they tended to have a long list of citations on the back too, in case someone was interested in where we had gotten that information from. Next slide. So just talking about a little bit about what we were able to achieve with the 87th Texas legislative session is we were able to provide a rapid response. So we responded to 91 requests from legislators over a 14-month period. So as you can see, a lot of them, the content was developed by us, but we also used content that was from other places. So for instance, a lot of legislators were interested in policies that other states had passed. So those were some of the information that we passed on. In terms of bills filed with the legislators that we were working with, they filed 19 bills that affected health. 8 of these bills passed at least one chamber of the Texas legislature, and 3 were passed into law. So considering everything with this session, we feel that it was a very successful session for our first time out. We also had 31 collaboration meetings between researchers and legislators, so we were able to facilitate that. Next slide, please. So now I'd like to talk a little bit about our evidence-based tools and resources. So in the next slide, you can see what we developed in terms of SPAN. So we really wanted to highlight the child obesity crisis in Texas. So we conducted our last SPAN in 2019-2020. So we ended data collection on March 13th, 2020. So the last day that we could go into schools. And even with that year, not quite a year of data collection, one of the things we did find is that obesity rates have gone up among all the grade levels of kids. So they range from 22% of kids in second grade have obesity to 28.5% of kids in fourth grade have obesity. So when you think about it, that's from basically 1 to 5 to you're approaching 1, you're over 1 in 4 children in Texas in fourth grade have obesity. So what we were able to do is turn those data into these reports that you can see here, where we really talk about health disparities, findings that we had, and then we also provide recommendations. So on the next slide, you can see the reports that were released through Texas SPAN. So we were able to provide information on obesity, nutrition, physical activity, screen time, and then other areas of our research in terms of teen vaping, vaping advertisements, sugar sweetened beverages, eating away from home, and sleep quality. So we have a few more of these reports that we are developing in conjunction with Department of State Health Services and then disseminating them. Next slide. So in terms of communications, our main areas of communication were through webinars. So we hosted and disseminated 23 COVID-specific webinars between April of 2020 and then October of 2021. So through that, we had a total of almost 15,000 registrants and 9,000 webinar attendees. We've also had people view these on YouTube later, so a significant number of people have reviewed these. We also began putting out a newsletter, and so the newsletter highlighted COVID-19 news and resources. So we've sent out 20 newsletters. They come out periodically. We basically just wait until we have enough information and then send it out. So that is distributed to legislators and their staff, as well as network members for the Texas RPC and our advisory committee. And so we have a 24% email open rate. So we know that at least a quarter of people who receive them are looking, and then they're clicking through on some of the news too. So we provide news from all of our researchers. So that's from various institutions across Texas, University of Texas, Texas A&M, Texas Tech, UTHealth, just a variety, Texas State. So we have a lot of institutions represented in our researchers. Next slide, please. So one of our main resources in terms of this is the Texas Legislative Session Bill Tracker. So I'd like to show a little bit of information about that. So this is a snapshot of what the Texas Legislative Session Bill Tracker looks like. So you can see that it references the bill, the author, the status, and then a brief description of this. So if we could go to the next slide. So this is a general timeline for the bill tracker. So we began tracking the bills. You heard Joel talk about the pre-filing date. So that's when we start tracking the bills. We track them through the session and then toward the end of the session. So we're really busy at the beginning going through all the bills. And then once we have a bill to track, we follow it as it makes its way through the houses and hopefully eventually to the governor's desk. Next slide. So a little bit about what we were doing is we tracked more than 350 bills this year. About more than half of those were addressed to healthcare access. So this was the first legislative session that we included healthcare access bills in our bill tracker. So we reviewed newly filed bills each week. We had a group of students and staff who determined which bills to track by consensus, and then we summarized them in plain language for the website. We also followed the bill through the legislative session, and some of those bills we were able to connect to historical data that we had. So 29 of the 352 bills we tracked were passed into law this session. Next slide. So this kind of gives you a breakdown of the tracked bills that we had this year. So we've tracked from 2013 to the current session, so with 5 legislative sessions. When we began, we had 53 bills we were tracking, and now we're up to 352. You can see there that 191 of those are healthcare access. So that really added a lot to our load this year, adding that. We cover 9 bill topics in 2021. The next slide. So this gives you kind of how the bills have changed over time from 2013 to 2021. So these 4 topic areas are the ones we've tracked every year since the beginning. And so food policy has remained pretty consistent, a few more bills this year. School health, there were a lot of bills this year compared to previous years. Obesity, as you can see it, did peak around 2017, but really relatively few obesity-related bills were being tracked this year. And then tobacco has fallen quite a bit. There was quite a bit of activity the last couple of years, so that's why we think that there were fewer of those bills this year. Next slide. So just a few conclusions about what we did and what we learned this year. So one of the things we did find is Texas legislators and their staff were interested in COVID-related and evidence-based resources. So they definitely saw this as a resource, and they really liked the state and legislative district level data that we were able to provide. So this is something that we really want to expand on in the future. We also found that this showed initial uptake in use, and we have such a short session. A lot of the work has to begin before the session, and as Joel alluded to, and then you have to be busy throughout the session as well. So really increasing the timeliness and usefulness of Texas data and policy decision making is important. And then just a summary is we found that state legislators really need those local data and resources to create evidence-based policies. The legislative bill tracker and the Texas Child Health Status Reports were nice tools that helped promote evidence-based policies. So we also found that collaboration, our partners, such as those in the partnership, were invaluable in terms of connecting us to resources. And public health advocates really need to track legislative policies, especially since we have such a short legislative session. So it's very important to stay on top of it. So in terms of recommendations, we've learned a lot about translating key research findings into usable, easy to read and digestible formats, and we're still learning. So it's a continual process. Tools such as the bill tracker and the child health status reports are created for policymakers and for advocates too. So they allow for evidence-based decisions, and it's something that we as public health advocates and the legislators too need to make good health policy and to improve the health of Texans. The next slide just shows our fantastic research team here. It takes a lot of people to pull this all together during sessions, so I'd really like to thank all of them. And then the next slide just lists our resources, and we can provide those to people too that are on here in case we don't want to leave this slide up. So thank you very much, and I'd like to turn it back over to Dr. Lakey.
Very good. Again, thanks, Deanna. Dr. Hoesler, for going through all the work that your incredible team is doing. We have several questions, and I would encourage folks that if you have something on your mind, a question you would like to ask our guests, to please put it in the chat box. But let me start at the top. And the first question we have is, where can I locate more information on the funding for chronic disease prevention? Joel or Deanna, anything you'd like to say about that? Joel, you're muted right now, my friend.
All right, how about now? Yes, so the Partnership for Healthy Texas website has our post-session debrief document that should have some information with all the details in there. And if there's additional or more specific information, folks can email me directly, and I'm happy to guide them through Senate Bill 1, which is very large document. But I'd start there with the partnership recap, which is on the website.
And maybe just to add just a little bit to that, I saw the question, went to the DSHS webpage, and the Community Health Improvement Division has a health promotions and chronic disease prevention section, and on their webpage they have the contact information there for their section in their division, and also outline the various programs related to chronic disease that they're currently involved in here in the state. And that's just the state work. The local health departments are also doing work, and you may be able to reach out to your local health department to find out the work that they're doing in your own community. Deanna, anything you'd like to add to that?
No, I think y'all covered it great.
Okay. So Deanna, this was probably going to you. What is the financial mechanism whereby researchers can dedicate effort to contribute to the Texas RPC?
Well, currently, that's one of the things we're looking at. So it's voluntary. Most of the researchers are doing this as part of their service requirement. I know that that's a big discussion among academia right now. Is traditionally there's been a focus on research and teaching, and perhaps less so on service, or producing products that maybe aren't in traditional academic literature. So that's one of the things that we're working on now, is what are the benefits for faculty that are involved. So one of the ways in which we've tried to get around this, and it was one of our lessons learned, is that the researchers and the legislators are all very busy people. And so it's really nice for us to have a support staff that can facilitate the meetings and getting the materials together. And that's absolutely essential, that you need those support people to kind of help. So we try and make it as easy for the researchers as possible, since currently that's not funded and they're doing it on a voluntary basis. And I might also add that all of them are doing this in concert with their government relations people at their campuses.
All right, very good. There's one question, I'm gonna try to summarize it. The questionnaire asks, basically what can we do better at looking at the medical causes of death in children? We have a Texas Child Fatality Review team that provides feedback. A lot of that looks at accidental deaths and a variety of other things. But how do we maybe get better at incorporating medical comorbidities, whether it's asthma or obesity, in that analysis of why kids die here in the state of Texas? Deanna, do you have any thoughts on that?
I think a lot of the data that we rely on would require partnerships with Department of State Health Services and having rationale for including those, perhaps on death certificates. I don't know a whole lot about this. Basically, a lot of times when we're looking at the data, it's kind of after the fact. And sometimes it's from Texas, sometimes it's from other places as well. So, Dr. Lakey, you probably know more about this than I do.
No, I guess the only thing I would add is that during the regular session, there was another bill working with the UT School of Public Health to develop an all claims database to look at healthcare costs and diagnosis, and there may be an opportunity there with some of the researchers to look at a little bit more in depth than what we're doing right now.
That's actually a good point, because I think with the healthcare data, we could pull out some information that would be helpful, at least to make some initial determinations of what's going on.
Okay. What does the geographic distribution look like for the researcher advocates? Are they from large metropolitan areas or not? Do you have a map by Senate House district coverage?
We don't really have a map by Senate House district coverage. We kept it more broad. One of the things we tried to do is when we were setting up the collaborative teams, we tried to pair researchers with that were in the district of the legislator. So we wanted them to have someone who was in their own district as much as possible. So sometimes with some of the legislators, we tried to find someone who was in their area. Most of them are in urban areas. We do have several, like in the El Paso area. Most of the time they're linked with universities, so that's kind of why they tend to be in more urban areas. That is something we were interested in, is how we can recruit additional researchers, because we would like to expand this network as much as we could.
Okay. Next question, again, Deanna, to you. For legislative tracking, some bills do not move, but then are amended onto other bills and reach the finish line. How can or does the tracker incorporate those successes?
We do it some, sometimes it's kind of piecemeal. So with those efforts, we don't always do the best job in linking them. We're kind of doing everything we can just to track them. But if anybody has any suggestions for us as to what would be a good way to present that in the legislative tracker, or to do a better job of doing that, we'd love to hear that. Like I said, we do it as much as we can, but sometimes we miss things, especially toward the end when things get a little fast and furious.
Yeah, I think that's a great question. It came from our friend Deanna Hoesler with Texas Cares for Children, and maybe a follow-up conversation would be helpful to figure out how we maybe adjust some of those thoughts and following bills all the way through. So that's good.
Yeah, that would be great.
Okay. Have you seen your Texas bill tracker and strategies to get bills passed used by other states? Anybody from other states looking at what you're doing here in Texas and trying to duplicate that?
Well, the Texas RPC project was adapted from something that was done by Penn State, but they did it for the federal legislature, not a state. So we were the first ones to do it at the state level. We did present at APHA last week, and we had several people come up to us and ask about it. I know someone from Michigan, for example, was interested in how we did that. So as of now, I don't know of other states who are doing this, but I know that there is some interest.
Okay. Can you talk a little more about the implications for shacks with some of the policies that passed to undermine their integrity?
I can do that, yes. And I'll just, before we go there, on the tracking and amendments, something we probably should discuss more, Deanna, is I know through the partnership, a lot of our folks use Telecon and we're able to track amendments, so maybe we can update our list. I know we kind of updated internal lists as the bills were amended at the end of the session, but we can have those discussions and moving forward. But yeah, so there, as I mentioned, a lot of the bills that were addressing school health advisory councils were targeted to having them fall under open records or establishing them as governmental entities, which our concern was that this would deter volunteers, parents more than anything, and others from being on those councils. Some of these bills were targeting as a result of specific school districts that lawmakers may have had some type of bad experience for one reason or the other. But what we were able to do, the one that did pass, House Bill 1525, that had the language that does require the SHAC meetings to be recorded and then posted online. Not a lot of guidance from the Texas Education Agency right now. I'm going to throw my good friend Michelle Smith under the bus here. She has made it a priority for her to help re-energize our shacks across the state of Texas. And she's already doing some webinars, going to be coordinating some briefings in the next few months and getting the shacks a little bit more proactive, as well as allowing us, the partnership and the Michael and Susan Dell Center for Healthy Living and others, to share the great things that the shacks can do and are doing. And so that there was a little bit of, we're going to go get these shacks. They backed off a little bit. The compromise was the recordings, not the best, but also I think we'll see how the implementation goes, but we definitely need to share the success stories of our school health advisory councils and get our folks more engaged as these school health policies that are impact the whole child are looked at by the legislators, so that we can bring in these experts from El Paso, Del Rio, South Texas, North Texas, everywhere that can talk to their lawmakers. So Adriana, we may be pulling you in on some of those meetings as well.
All right, Joel, I'm gonna go to you again for this next one. And Deanna, I would also like your thoughts on how receptive are the legislators in addressing social determinants of obesity, versus nutritional, physical activity related determinants. How do you think and Joel, you talked about this a little bit of some of the challenges in the Medicaid and the social determinants of health legislation moving forward. Any thoughts related to how receptive the legislature is, especially related to obesity with social determinants or social factors?
Social factors, I think it is a little bit of an uphill challenge at the Texas legislature. It's going to be critical for us to educate lawmakers and help them understand how social determinants of health impacted chronic disease. They understand nutrition, they understand physical activity. A lot of lawmakers just will have to use this opportunity to educate them and help them understand some of the challenges that are there, some of the great things that are happening in their community local level that they may not know that are targeted to social determinants of health. So it's an uphill battle, and I think we can get there. We made some progress in the House, I believe, this session, but I think we're going to have a do-over now because of leadership members retiring, and so I think we have some work cut out for us, but I think it's doable. It's going to be a couple of session steps, I believe.
Yeah,
Yeah.
I could just real quick comment. We did a survey a few years back, and what we found is the legislators, it's exactly like Joel said, they don't connect some of the social determinants of health with outcomes. So, I mean, really trying to find the evidence base to support that, bring in stories of people who can build on the data, that's important.
Very good. And so I think we're out of our time. Right now is 12 o'clock. I know there are several other questions, and we'll try to get back to you on those questions, and would also ask you to contact us and through the Partnership for a Healthy Texas or the Michael and Susan Dell Center for Healthy Living for any questions you have or any other thoughts you have related to how we can really improve upon this fight of obesity here in the state of Texas. And so Dr. Hoelscher, Joel, Romo, I really appreciate your time today, and take care, everyone. Look forward to seeing you again. Thank you.
Thank you. Bye.
Thank you.